Okay, I'm going to be talking about bartonella infections. So first I'm going to talk about Henselae, and this is known, Bartonella henselae is known as cat scratch disease a lot, or cat scratch fever. It can also cause endocarditis, and those are in immunocompetent patients. And then in immunocompromised patients, especially AIDS patients, it can cause bacillary angiomatosis, which are these raised cherry red macular lesions or vascular lesions on the skin and the visceral organs. And all of these are caused by cats. Cats and cat fleas spread it throughout cats, but usually humans will catch it from actual contact with cats and having the scratch and the saliva in the cuts. Cat scratch fever obviously has a fever, and it has a characteristic papule and lymphadenopathy chronically, especially in children, because they play with cats and they're not as cleanly, and then splenomegaly. And a lot of times you'll see like the papule and the lymphadenopathy on the same side of the body as the scratch was. And then Bartonella quintana, so like Quintana Mobe. So I just associate that with the military a little bit, and trench fever is what's caused by Bartonella quintana. And it's spread by body louse. So like when a lot of guys are down in the trenches and they're living in close quarters and dirty, they can spread body louse. And it'll present with joint pain, truncal rash, headache, retroorbital pain, and on a very serious consequence of it would be heart damage. And it can be seen in like U.S. shelters where there's homeless people with body louse. Next is Bartonella bacilliformis, and it has a lot of different names for the diseases. The carrion disease, Oraya fever, and can't read my writing, Verruga peruana. I speak Spanish and I can't pronounce anything. Okay, Verruga peruana, and it's spread by sandflies. Just in like the Peru, Colombia area. So the sandflies are the vectors, and then the bacilliformis bacteria, they go into the erythrocytes and the endothelial cells, and that's where they multiply. So they can cause acute hemolytic bacteremia, and with a large fever and severe anemia. And then it can be followed by a chronic Peruvian wart. That's what Verruga peruana means. So you'll have this chronically peripheral, perforative Peruvian wart, and if it goes untreated, it's has a high mortality rate. Oh, and so Bartonella. So treatments for cat scratch fever, azithromycin is the most common. Azithromycin, cat scratch fever, azithromycin. But the most common treatment for Bartonella infections in general are erythromycin or doxycycline.